One common question I get often asked by patients is, what supplements or vitamins do I recommend? So I would say there are 4 vitamins that I recommend for most people, and these are the most research-backed, have definitely provided. The first vitamin I would recommend is just a good multivitamin. So not these Centrum or one-a-days. I typically recommend you try to pay a little bit more to get a better quality. So typically in the supplement aisle, the more you spend, the better ingredients, the better quality, the less fillers you will have in the vitamin. So if you can pay a little bit more, get a better quality vitamin, a good multivitamin will help. That's the first one I would recommend. The second vitamin I would recommend is a vitamin D supplement. So what you want to do is when you get your next physical, you want to have your primary care doctor run a blood panel and check your vitamin D level. I would say about 75 to 90% of patients are actually deficient in vitamin D. And the reason for that is we all work indoors, or we live in an area maybe where there isn't as much sun throughout the winter months, and we often become very deficient in this. And it's a very important vitamin. It's actually a hormone that helps to not only work on your bone strength, but it has lots of other important processes that it works throughout the body. In the latest situation with COVID, vitamin D deficiency has been linked to more severe symptoms with COVID patients. So you definitely want to check your vitamin D levels. And then what you want to do is, if you are severely deficient, your medical doctor will put you on a prescription level vitamin D, which is what the dosage is 50,000 IUs of vitamin D. And typically you'll do this for about a month, and that will get your vitamin D levels up into the normal range. Then what you want to do is you want to take a vitamin D supplement on a daily basis. Typically I recommend about 5,000 IUs a day. And again, a lot of people think they get enough in their multivitamin, and they don't. A lot of times they may get 400 IUs. Well, I recommend 5,000 IUs. Again, remember the prescription level is 50,000. So that's at the extreme high level. We're not going anywhere close to that. 5,000 IUs on a daily basis is very safe and stable. You want to make sure that your vitamin D is D3. So there's D1, D2, and D3. D3 is the most readily absorbed by the body and the one we would recommend the most. And the one that I take is binds vitamin D3 with K2. K2, vitamin K, is involved in clotting, and it helps the absorption of the vitamin D3. So try to find one with D3 and K2 combined. And again, you're looking to take about 5,000 IUs of that daily. The third supplement I recommend to most patients is a omega-3 fish oil. So fish oil is very good at decreasing inflammation throughout your body. So say you're dealing with chronic arthritis and you have chronic joint pain. If you take fish oil combined with a healthy diet, that can help to reduce the overall levels of inflammation in your body, and that will help to reduce your overall chronic pain that you're dealing with, or even if you're dealing with an acute situation, it'll help you recover that much faster. The fourth supplement I typically recommend to most patients is a magnesium supplement. So magnesium is very important with muscle tension and tightness, and also cramping. If you deal with chronic cramps at night, or you deal with chronic muscle tension, taking magnesium supplement will help to reduce that overall tension in the muscle. But it's also involved in thousands of processes throughout the body. And so it's a very good supplement that has been research backed and can help overall your functioning of your body on a day-to-day basis. And typically you want to take as much as you can before it starts to give you GI troubles. And then once you kind of find that dosage, it may be 1,000 milligrams or whatever that amount is, and you want to just kind of take up to that level so you don't get GI distress, and that's going to be the optimal level for your body. Some people may be higher, some people may be lower. It just depends on the person. So again, a magnesium supplement is great for muscle tension, tightness, cramps, but it also deals with a lot of other processes throughout the body. So that's a great supplement to take. A bonus supplement that you can take, especially if you're in a cold or flu season, or again, during this COVID time, is going to be a vitamin C supplement. So vitamin C is very important it's an antioxidant. It's going to help to remove any toxins throughout your body, and it just will help you recover that much faster from that cold or flu, or help you even decrease some of the symptoms during this COVID time. So I would recommend taking a vitamin C supplement. Again, what you want to do with the vitamin C is take as high a level as you can with, maybe about 5,000, and see how your body handles that. If that is causing you diarrhea, you're going to decrease the amount you're going to take until we get to that point where you don't have any GI distress. And that's going to be a good amount to take, again, to boost your immune system and help that antioxidant, help your body process things. So I hope that answers a common question I get of what supplements do I recommend for most patients. If you have any questions, reach out to me at 703-912-7822 or schedule online at novacarwellness.com.